Thank you so much. Thank you for your flexibility. You know, our delegates' business meeting ran a little late, so we're playing catch up, and I appreciate your cooperation. So at Hadassah, we have always been at the forefront of healthcare, advocacy, and education. We are about to dive into a topic that is deeply personal, often political, and profoundly important: women's reproductive health. This issue affects women's bodies, our choices, our families, and our futures. And as a women's Zionist organization rooted in compassion, education, and action, Hadassah is uniquely positioned to lead this conversation. Our speakers today bring expertise, experience, and insight that will inform and, I'm sure, inspire us. We are here not just to listen, but to leave more educated and empowered as advocates and allies. This is a timely and important topic, and it's exactly the kind of leadership Hadassah is known for. So let's begin. Please join me in welcoming Elizabeth Cullen, Hadassah's Government Relations Director, who will moderate and introduce the panel.
Okay, so I am truly honored to be here with these amazing women who are going to talk to us today about one of America's most embattled issues, reproductive choice. I actually moderated a panel with Alana Frank a couple of years ago, and Allison, I've been following the creation of the Red Tent Fund since its inception. You're in my community. So Hadassah has long advocated for every woman to have the right to control her own reproductive future, as Jill said, including if, when, and how to have children. We support access, resources, and funding for the whole spectrum of reproductive health care, including fertility treatment, maternal and postpartum care, contraception, and abortion as critical components of women's health care. And I want to remind everybody, we're sitting here today in a state with a 6-week abortion ban, a time when most people don't even know they're pregnant. Today's discussion is going to focus what's happening on the ground. What are the consequences of the Dobbs decision over the last 3 years? What are the challenges for individuals seeking different types of reproductive care? What resources are and are no longer available to help provide information and assistance? And what are the risks of accessing that information in an era where a person's digital footprint can be tracked and is being tracked? One thing is abundantly clear: the Dobbs decision overturning the constitutional right to abortion did not simplify things. It's exponentially more complicated than ever. And to put this point in perspective, the National Conference of State Legislatures says that states have enacted more than 1,000 laws related to abortion. And in states restricting it, those measures are proposing or already decreasing access to information about reproductive health care, including contraception, such as IUDs and emergency contraception. And on the flip side, I have to tell you some good news. States are protecting reproductive rights by considering or passing new laws to shield providers and to make abortion care more affordable and accessible. And I have to give a shout out to our Maryland chapters because they led the advocacy in Maryland for a state-funded abortion fund, first of its kind. Meanwhile, in Congress and watching what's happening, over 80 bills have been proposed to further restrict abortion. And the administration has been proposing to roll back guidance, or already is, to protect women in emergency care crises, to undo patient privacy, specifically for pregnancy and abortion, and just this past week, proposed to roll back abortion care in the VA health system for women who've served our country, and to only allow it in the case of to protect the life of the mother, not her health, not rape, not incest. And lastly, we know that HHS is already re-examining the already extensive evidence of mifepristone safety. The HHS website no longer has information about abortion, and programs which provide funding for family planning and sexual and reproductive health care to low-income Americans in particular are absolutely in jeopardy. So, what does all this mean for women across the country? Our speakers are going to address that. I'm really honored today, I'm going to go in order, to present Allison Trombers-Corman, who's the Executive Director and founder of the Red Tent Fund, an abortion fund, a national abortion fund rooted in Jewish values and teachings. She's the former Senior Operations and Strategy Director for my own DC Abortion Fund, where she resigned after October 7th, 2023, to found the Red Tent Fund to unite Jewish values with direct abortion access, ensuring that no one would have to choose between their identity and their commitment to reproductive rights. On her left is Dr. Mimi Zeman, who is an OB-GYN, a reproductive rights advocate, and, in her spare time, an award-winning author. In addition to her play, The Post wrote monologues, which tells intimate stories highlighting the effects of the Dobbs decision, editing and authoring Managing Contraception, a magazine. She's also the author of an award-winning memoir called Tap Dancing on Everest. And last but not least, I want to introduce you to Alana Frank, who's the CEO and founder of the Jewish Fertility Foundation, which she established after undergoing her own personal journey to seek fertility treatment. And because she was a resident in Israel at the time of her first two children, she was able to reach an affordable solution. But when she returned to the US, where fertility treatment is not covered for things like IVF on a national basis, she realized that there was a grave need for funding, support, and increased awareness. So she created the Jewish Fertility Foundation. So I want to turn now first to Dr. Zeman and ask, you've discussed and written about the struggles of practicing healthcare, specifically women's healthcare, in the South. And I hope today, if you can, please share some of the real-world health consequences for women and teen girls that you are seeing in states with abortion bans. And how is this impacting both your ability to provide care and your physician ethical obligations?
Thank you so much, Elizabeth, for your question. Can everyone hear me? Great. I'm very honored to be here with the fierce, amazing Hadassah women, so thank you. And I want to start out by saying that abortion bans or restrictions exist in the majority of states. There are only 9 states that have no abortion restrictions. And the real-world consequences are many, and I know you're aware of many. They include cancer patients being unable to treat their cancers if they're pregnant, miscarriage patients denied care because of the fear that the situation violates abortion bans, people with non-viable pregnancies, like ectopic pregnancies, not getting care, and women have died as a result. All of this was predictable. I am one of many, many people who stood in line to testify against our Georgia abortion ban in 2019. Over 100 of us. Thank you. And we told them all of these consequences. Nobody can say that they didn't know that women were going to die. I myself had a non-viable molar pregnancy patient last year that could not be seen at Planned Parenthood, where I was working, and referred her back to her private OBGYN, who would not take care of her. She had to go to multiple clinics in town to get care. I have had rape patients who should have been able to get an abortion. However, the stipulation is that they file a police report. No, they could not get the care they needed. So there's so many stories like that. I'm sure you know of the very sad story of the woman in our state, Adriana Smith, who suffered a stroke and was brain dead at 8 weeks pregnant, and they kept her alive just to gestate the fetus. So there are many terrible consequences. One thing I've written about a few things. One weird thing is that when I pick up a patient's chart, the first thing I look at is what state is she from? What's her address? That's nonsense. I shouldn't care about that as a doctor. I should be just delivering the best care I can. But I have to say, is she from Tennessee or Mississippi? What's the state law there? What happens if I send her back? I've also written about how this violates medical ethics. We have taken oaths to provide, ethical care. These include respecting patients' autonomy, which the bans violate; beneficence, which is the obligation to act in the best interest of the patient by providing the most effective and safe treatments. No, bans make us not do that. Do no harm. We are causing harm because carrying a pregnancy to term has the risk of death 35 to 39 times greater than an elective abortion. And the final principle is justice, which means that everybody should have equal, equitable access to care. And these bans are based on geography. We are not providing equal access. So to answer your question, how has this impacted healthcare providers? OBGYNs practicing in states with bans report stress and fear. They are leaving those states. Medical students are not applying to states with bans. Applications to OBGYN programs dropped 21% in Alabama, 16% in Georgia. A survey of medical students in Indiana said they were 70% less likely to pursue residency in states with abortion bans. Idaho lost 35% of its OBGYN workforce. I'll end by saying that one study out of UCSF published a year ago documented 86 cases of women not receiving appropriate emergency care, and most notably women of color. These were people with obstetric complications prior to fetal viability, such as premature rupture of membranes, hemorrhage, and underlying medical conditions that made continuing a pregnancy dangerous, for example, hypertension. So the consequences are enormous, wide-scoping, and completely unjust for women.
Thank you so much, Dr. Zimu. And I want to just impress upon people also a new study just emerged pretty recently, which documented that women in states with abortion bans are twice as likely to die during pregnancy. So this is starting to be looked at and tracked.
Yes, and infant mortality is up 6% in states with bans, too.
So Alana, your personal experiences with infertility led you to establish the Jewish Fertility Foundation and support families on their journeys to parenthood. What are some of the challenges that you and your colleagues have faced to help families in this journey to parenthood?
Sure. And can you all hear me in the back? All right. So in today's post-Roe world, we are not just dealing with barriers to abortion access, like many of us think. We're seeing direct threats to IVF and fertility care. So last year, in an unrelated case, the Alabama Supreme Court effectively redefined when human life begins, ruling that frozen embryos created through IVF are legally children. So I want to give you a little biology lesson. I'm no doctor, but in order to try and attempt to make a baby, you need an egg, you need sperm, those together create an embryo, and then you need a womb or a uterus to try to have a baby. So IVF is a medical process where eggs are retrieved from the woman, fertilized with sperm in a laboratory by amazing embryologists, and grown into embryos before being transferred into the uterus or frozen for future use or testing. Is that accurate? Okay. So the court's decision meant that handling or discarding embryos could now carry legal consequences, prompting clinics, fertility clinics, to shut down overnight. Okay? So we have offices in 13 states nationally as Jewish Fertility Foundation, including Alabama. Families mid-treatment were left in limbo, including women who already were enduring daily hormone injections. How many of you know people who have gone through IVF? Right. It's a roller coaster of emotion. It's like hope and heartbreak every month. Now imagine adding that all of a sudden you get a phone call from your doctor saying, I'm so sorry, but I can't see you tomorrow. I can't treat you. And they're literally preparing for their egg retrieval just weeks away. Okay, so I want to reiterate that destroying embryos is the same as killing a human life. So luckily, we were in a moment of frenzy. We were able to pay for some of the patients from Alabama to quickly come to Atlanta, which is a few hours drive away, so that they could continue their IVF cycle. They were mid-cycle. Luckily, 2 of those babies have since been born, but it's cute, yes, but the trauma, uncertainty, and chaos that the parents endured, it was just too much. And it's not over. We're going to hear more. I mean, I remember the moment that Roe was overturned, and we were on a panel together. Our clients from all over, not just Alabama at the time, started reaching out with the same urgent 3 questions. Can I still do IVF? What happens to my embryos? And what if I do get pregnant and need to terminate? Because unfortunately, that is also part of the IVF journey sometimes. And the confusion and fear was palpable. So laws, just so we all are on the same page, they vary wildly by state. We reached out, luckily we work very closely with fertility and reproductive attorneys, and we had to reach out to every single state to try and understand what was legal. I love our reproductive attorneys. We work very closely together. Nobody had real answers. There was just mass confusion. And right after Alabama's fertility clinic closures, I mean, we were getting desperate phone calls. Our inboxes were flooded with calls from all over the country, and we didn't even know how to respond. What we did know is that our attorneys were fearful of this. This was the worst case scenario of what was happening. In all of that chaos, I connected with Ashley Dunham, with a huge Southern accent, one of our reproductive attorneys in Alabama, and she's now a candidate for state office. And she was a fierce advocate for reproductive justice. And in that moment of fear and uncertainty, her voice was steady and strong. And I'm so proud of these, can I say, badass women who are not just, trying to figure out the situation at the moment, but really trying to take control and make change. And the fear has not gone away. There are Band-Aid laws now in Alabama, but many providers in states with personhood laws are still hesitant to offer full services. And patients, just like having to do with abortion, are crossing state lines to finish their treatment. Standard IVF processes and practices include discarding non-viable embryos. You make a lot of embryos to try to find one good one, and we offer things like genetic testing, but having sometimes to reduce embryos in multiple pregnancies can now carry legal risk. So we already know that there's a huge emotional toll having to do with fertility treatments and IVF. Now, in this whole roller coaster, we're having to continue to offer mental health services on top of everything that they're going through. And we're seeing it very clearly that people need emotional safety as much as legal clarity. Scary times.
Indeed. Thank you, Alana, for really laying out just how how extensive the consequences are for these kinds of abortion bans, and the range of the kinds of state laws being enacted. So Allison, your work with the Red Tent Fund really touches people from all walks of life, working with clinics around the country. Can you tell us a little bit more about the individuals who are seeking assistance from abortion funds, and what are the key misconceptions about the population? And if you could walk us through a little bit of the challenges people face to access care, and how abortion funds have been dealing with this, with truly an onslaught of demand.
Absolutely. Can everyone hear me? Excellent. Good afternoon, and thank you so much for having all of us here for this discussion. I mean, I think all of us feel that this is incredibly important, and hopefully you do too, and so I'm really honored to be here to speak about this. And I think all of you in the room already know this from what you've heard from these two fabulous individuals. There has never been a more important time to fund abortion in this country. Never. We are at a critical moment. And at the Red Tent Fund, we fund abortion for all with funding from the Jewish community. So I founded the Red Tent Fund a little over a year ago. As Elizabeth said, I had been working at a local abortion fund in where I am living in DC, and the anti-Semitism that I experienced, the feelings of anti-Semitism that I experienced after October 7th in that work, in that organization, were so crushing that I felt that I had no choice but to resign. And I decided to create an abortion fund where people would not have to choose between their support for reproductive health and rights and access and their Jewish identity. So we're now a little over a year later, and the Red Tent Fund has funded over 800 patients to fund their procedural abortions. And excitingly, we are on track to fund over $500,000 in procedures in 2025. Now, the good news is that's a lot of people who were able to access abortion care. That's a lot of people who were able to bridge the financial gap to get the care that they needed and that they wanted. The not so good news is that number, $500,000 in abortion procedures, about 1,400 people we'll be able to serve by the end of the year, is just a drop in the bucket of what the actual need is out there. So you asked about kind of who is using abortion funds, how, who are we talking about here? So abortion seekers in this country, generally speaking, are by majority in their 20s. More than half of them are already parents, and about 40% of them are below the federal poverty line. And what that means is that when it comes time to actually pay for the abortion care they want or they need, Alana, like you were saying, it could be a situation where it's very much needed, or Dr. Zeman, for medical reasons, those procedures are financially out of reach. The average first trimester surgical abortion costs about $600. The Department of Treasury, or whoever studied this, I don't even remember which agency it was, for the average American, an unexpected expense of $400 or more means they are either borrowing money or selling their belongings to pay for that unexpected expense. So when you are talking about a first trimester procedure that costs $600, that gives you a sense of how many people abortion care is financially out of reach for. So to further complicate the landscape, as my colleagues have been saying, abortion is now restricted or entirely illegal in about half the states in the country. I always say about half the states because on any given day, there's a judge, there's a court case, there's a decision that's coming down that's flipping things kind of to your point about how quickly things can change. So about half the states where it is restricted or entirely illegal.
And so now patients are not only financially out of reach of abortion care, but they are now having to travel hundreds or even thousands of miles to access that care. In June of this year, our average patient had to travel 250 miles to get the abortion care that they needed. So what does this look like for people when you're getting in the car or getting on a bus or maybe taking your first flight? You've never been on an airplane before, and you are leaving your existing children at home, child or children. You're leaving work, you're missing wages, and you are trying to get to a state where you can access abortion care. But for so many of our patients, they've spent all their money just getting to that state. So they're arriving at clinic with no money left to pay for the actual care that they are there to receive. And that's where abortion funds like the Red Tent Fund come into play. One of our patients that we funded had driven from where they lived in Texas to where they were receiving abortion care in Kansas. And by the time they arrived, they had no money left to spend on their procedure. So the Red Tent Fund stepped in and paid so the person could actually get the procedure that they needed. One of our other patients was insistent that they help pay for the cost of their procedure. And so they used their $200, that was their 2 weeks food budget, to try to pay for their procedure. And when they mentioned this to clinic staff, that they were not sure how they were going to pay for food for the next 2 weeks, the clinic staff was able to step in and say, there's someone who can help. We have funding from this organization. You don't need to make the decision between food and abortion care. So these stories are very, very real. They are heartbreaking, like you all were saying, and unfortunately, they're only getting worse.
Thank you so much for founding the fund and for explaining to us some of the challenges that we may not completely understand, not in an intimate way. So Dr. Zeman, in the last few months, we've witnessed federal funding cuts to Title X, Medicaid, women's overall health research at NIH, all of which may jeopardize women's access to affordable contraception, maternal health care, as well as women's overall health care, and threatening to send medical advancements backwards. Can you walk us through a little bit more how these particular cuts, Medicaid, Title X, will affect women's access to reproductive care and health outcomes?
Sure. And the same populations that can't afford abortion have trouble affording birth control. Now, some of that is allayed by having Medicaid or, ACA insurance plans that cover contraception. It was such a huge deal when the ACA decided contraception would be covered for everyone as a necessary preventive health service. But half of women ages 18 to 49 report that cost of contraceptives limit their use. Now, Title X is a federal program actually started in the Nixon administration in 1970 to provide free birth control to women of low income. And now the current administration is withholding those funds. And as a result, 15 organizations are suing the administration over this. So the same, president had already limited contraceptive access by saying that any organization could decide they didn't need to cover contraception if they had a moral feeling against it, which really, they didn't have to be religious or anything. They could just decide to opt out of covering contraception. This particularly affects women of color who have higher uninsured rates and higher unintended pregnancy rates. And as many of you know, I'm sure the recent budget bill has reduced a lot of Medicaid coverage and defunds places like Planned Parenthood, which happens to be the biggest provider of birth control in the country, not allowed to get any federal dollars if they happen to provide abortions, even if they're not using the federal dollars for abortion. So there are so many ways that birth control access is under attack right now. As a result, both at the state level and national level, people have sponsored right to contraception acts, which are constantly blocked because one party will not get behind the right to women to have contraception. Even though that was passed in Virginia, the governor vetoed that bill twice. So
Thank you.
it's beyond abortion, just as you had mentioned, fertility. It is creeping into birth control. And I just want to add, use of birth control is the best and most effective way to decrease abortions. So.
Can I add also, in our world, I mean, fertility treatments, timing is everything for our doctors, and contraception is such a necessary part of the planning process to be able to get good quality eggs, remember, to make those embryos. So even in our world, we have to use contraception at the right time.
Absolutely. And that's a great point, Alana, about the intersection. I like to think of this as, it's all connected, and that's something that people don't always realize. Every aspect of this is connected. Postpartum maternal care for women who are on Medicaid. Medicaid is the largest provider for the largest insurer for maternal birth in the country. It covers 40% of the births. If more women are kicked off by their states from Medicaid, which can happen because it's optional, they're not going to get postpartum care. So Allison, one of the things we talked about in preparing for today was about healthcare data, medical privacy, reproductive health privacy in particular. Can you please tell us a little bit about how an individual's digital footprint intersects with pregnancy and reproductive care? I know one of the local abortion funds, I asked as an example, how are you getting information out to people about the abortion fund? And they were like, well, social media. That means somebody's using their digital footprint. So can you please elaborate a little bit on that?
Yeah. There are so many ways that the digital footprint piece plays into it. That's a great example. I've actually, I've heard the flip side of that, the analog way of sharing information. I don't know if you've ever encountered this, but I remember talking to an OBGYN in a state where abortion was banned, and they weren't able to counsel their patient on where they could seek abortion care. So, we all walk around with those big water bottles all day with, trying to hydrate. And this abortion provider had a sticker on the side of her water bottle that pointed people to where they could get information about abortion resources. And she would just turn her water bottle to face it to the patient. Couldn't say anything, but would just... So that's, I guess, the creative flip side to this problem. But really, data is being used to criminalize pregnancy and abortion. That's what's happening in our country right now. Information we all know is being collected about us all day, every day. But when you think about tools that people willingly opt into, understandably, things like period trackers, things like fertility trackers, that information can be used. And I don't want to speak blanketly. I don't know what everyone's terms of service are for their individual apps. But the concerns are this type of data is being used to weaponize and criminalize reproductive health care. So just for an example, at the Red Tent Fund, where we are collecting as little information as humanly possible about the people that we are serving. We are collecting the bare minimum data because I want to do everything in my power to protect that data and keep it out of the hands of those who would want to weaponize it, bring criminal charges, bring civil charges, what have you. Thank you. And even still, we are having to pay, as the Red Tent Fund, tens of thousands of dollars for a digital security audit. We are working with a private organization who actually works a lot with the Jewish community to do a digital security audit to make sure that we are limiting every possible opportunity for people to subpoena or gain access to that data. But there are things we are reading in the headlines and things we are seeing, things like license plate databases and tracking abilities that are, we fear, going to be used and weaponized to track people's movements, particularly as they are traveling from states where abortion is banned to states where they can get care. So it's a really fraught moment.
That's my understanding from a special digital privacy task force that I heard from a while ago. And so thank you for outlining that for everybody. And this is really a question we're coming not yet to the end, but close. So I have a question for each of you. As Jewish women in this space, how does your Jewish identity factor into your commitment to this work? And what would each of you say are some tangible things that our Hadassah members can do to help women in this environment of constant threat? Dr. Zepin, and we can go in order that we've been talking.
Yes, I mean, we have to remember that, the fight against contraception and abortion and for personhood laws are based on a religious belief that is not shared by our religion. And so it is our duty to inform the public that the Jewish approach is different. We don't believe that embryos are the beginning of life. And that's what a lot of these laws are based on. I believe that everybody can make a difference. Just being at this luncheon and going home and talking about one issue and maybe informing one of your friends. We all have a voice, and, my father was the only survivor in his family from the Holocaust. He always used his voice and just made that huge impression on me to use my voice where I can. And I think that we all can do that.
Thank you. So you're not just using your voice, you're using your pen or your laptop.
Yes.
Alana?
Sure. So I always go back to being fruitful and multiplying. What if you can't? What if you're like me and your tubes are blocked and you need reproductive assistance in order to have children? And our reproductive access right now is being blocked. What does that look like when families literally cannot be built without everything we're talking about? I think one of the things that's really important is to speak up. It's embarrassing to talk about, your sex lives and if you've had an abortion or if you need fertility treatments. It's embarrassing, but talking about it and, reducing the stigma is helpful and important. I think just advocating against personhood laws in your state, nationally, is really important into this reproductive justice we're talking about. And then supporting candidates like the woman that I was speaking about, Ashley Dunham. I mean, she is a reproductive attorney who is taking her own personal experiences with her clients and herself and really trying to make change. I think you can do a lot just by sharing, talking, being in groups like this. It makes a big difference.
Thank you. And Allison, I wanted you to speak last to this because specifically of your experiences and why you had to found the Red Tent Fund. So.
I think that being Jewish is such a huge component of who I am and what brings me to this work. And so it's really hard to think about how doing this, how I would do this work without thinking about my Jewishness and the values that, we all bring to our lives and to our community. And, I just think Jewish women in particular, we have not just been in this movement, we have led this movement. The movement for reproductive rights, the movement for reproductive access, we have been at the forefront of this since the beginning. We were talking a lot today about Planned Parenthood, and I think most people have heard or know, or maybe it's just people in the reproductive health field who talk about these things too much. But if you ask someone who's the founder of Planned Parenthood, they will tell you probably Margaret Sanger. Maybe they remember that Margaret Sanger co-founded what became Planned Parenthood with her sister. What so many people don't know, and what I didn't know until about 2 years ago, was there was a third person, a third co-founder, Fania Mandel, a Jewish Russian immigrant who co-founded Planned Parenthood with them. We have been in this movement since the beginning, and we will not be pushed out of it. So I have things that people in this room can do. I think we were all on the same brainwave here when we talked about using your voice. And we need you to fund abortion. The average patient pledge that we make is $360 per patient. Now, I happen to love that that's a variation of 16. I think it's Bashert. I think it's lovely. So whether that is funding $360 for patient care, for abortion care, whether it's $180, whether it's $18. I always think our auditors must be so, our financial people must be so confused. Why do you get all these increments of 18? What is happening at this organization? I'm like, it's fine, it's a Jewish thing. So we need you to fund abortion. That is the most important thing you can be doing in this moment. And I need you to be using your voice, as Dr. Zeman and Ilana said. We are a small organization, and our biggest challenge is getting our name out there. All of us know 5 people we can tell who care about reproductive health, whether it's friends or nieces or aunts or mothers or daughters. We all know someone. So I want you to go home and tell 5 people about the Red Tent Fund, not just because I want to fund abortion, and I do, but also I don't know who is going to need that abortion funding someday, and I want them to know that we exist and we are here for them when and if that day comes.
That's an excellent point, Allison. I've heard activists, longtime activists, including Heather Booth, who I know has spoken to our larger Hadassah audience as well as to individual chapters, who that's a part of her advocacy training is tell 5 people. So thank you so much. Well, I just want to close by urging everyone to go to our National Action Center on a regular basis. We have actions for reproductive choice up there, both supporting new legislation like the Women's Health Protection Act perhaps, or the right to contraception, as well as opposing all of these measures that are coming into Congress. And my concern over the long term is that the more legislation there is that tries to restrict abortion and abortion information and abortion services across the country on a national way, the more that conversation's being normalized. It's never really been about returning this issue to the states. And we're seeing that very much at the national level, so I urge you to take action with us on a regular basis. Thank you. Thank you.